In continuing with advances in anti-aging, I'd like to again welcome you to the A4M conference, and if you have questions of any of the speakers as they step outside of the room, they can address those questions and we can continue to assist and help you in each of the areas. And of course, down at the exhibit halls, most of the educators and speakers will be there to answer your questions. Friday night I'll be speaking from 7 to 9 p.m. on how to live longer than the oldest man in history. I'm Dr. Nick Delgado, author of Stay Young, and our next speaker has influenced me quite a bit since I use his laboratory facilities at ZRT.
Does that work okay?
They're out of Beaverton, Oregon. Jim Paoletti has done his work on the endocrine system, the treatments of symptoms and deficiencies using bioidentical hormone replacement therapy. I think you'll find his talk extremely informative, helpful, and some of the basis of all of anti-aging revolves around the proper balancing of hormones and the correct treatment and introduction and utilization. Oftentimes he is involved with education, consulting, and continuing education credits for doctors, nurses, and pharmacists, and he's been a regular at the A4M here, and I'd like to welcome Dr. Jim Paoletti. Thank you, everyone.
Thank you. Good job. If I told him Paoletti or anything close to that, I don't care. It's proper pronunciation of my last name, but he did very well. How many people are first-timers here at A4M? Cool. Good number of first-timers. I don't know what my presentation is. What am I talking about today?
Are you...
That's it.
This one right here?
No. Number 2 right there.
Number 2?
That's it. All right. It always amazes me when I come to A4M and talk. Well, not always, but several times I come, and the title on the agenda is different than the abstract or I submitted or the presentation. So really what I'm talking about is physiological dosing of hormones today. And I don't have much time, because I'm going to talk really fast so I can make up for the times from the last presenter. Now, I've heard Dr. Kendall Stewart talk that same presentation, only I was privileged when he was given 4 hours to do it. So when you guys see him at a workshop next time, you really got to go hear that entire presentation, because that was just too much to do in half an hour, but he's got great information. So, all right, let's talk about hormones and dosing them correctly. As soon as I figure out how to work this thing. There we go. Those are the objectives. We're going to talk about the actions of hormones and how they are different when you have a physiological level versus a supraphysiological. We're going to look at what our goals are when we obtain a physiological level. It's not just about making her feel better or making him feel better. And we're going to talk about mostly appropriate measurement of hormones according to your dosage route. Okay? So the number one goal of balancing hormones is not to treat the hot flashes and the poor sleep and the weight gain and the irritability. It's to provide the protection that the hormones have provided for all the systems of the body for years. Because here's the thing. You have a menopausal woman going through all the typical menopausal symptoms. She feels lousy. You need to take care of the symptoms or she's no longer your patient. But the symptoms of menopause do not kill her. So that's secondary to providing the protection of the cardiovascular system, the bones, the nervous system, the muscles, the immune system, etc. Everywhere in the body, the hormones are there at physiological amounts and balance, providing protection of those systems. That's our number one goal. Close behind it is treatment of the symptoms. Okay? At least that, in my mind, that's the way it should be. When you are starting a patient on hormones, you are really stuck between a rock and a hard place. How soon does that patient expect what you're doing to help her symptoms? Yesterday. Right. How quickly? I mean, they want to feel bad right away. It is very difficult to give a patient physiological doses of hormones and have them work very quickly. It's real easy to give supraphysiological doses and get a quicker response. But I'm going to show you where giving supraphysiological doses can cause harm long term. So I know it's a dilemma. People say, Jim, if I use your way, people aren't as happy as quickly, but they're better off long term. So I know it's a tough decision. It's a tough decision. So I'm just going to share you some insights. Since I've been doing this for more than 25 years now, I've made some women unhappy, but the majority are happy. So, all right. There are two reasons why you need to keep the level physiologic. First is there's a thing called tachyphylaxis hormone receptors, and then there's the possible harmful effects of too much hormones, and we'll talk about both of those. Tachyphylaxis. When you get too much hormone, you can downregulate that receptor, that hormone receptor, or maybe another hormone receptor too. Okay? And you can decrease the number and or the sensitivity of the receptor. So you're not going to get the genomic response. And that's going to cause the fact that the symptoms of too much of a hormone often mimic the symptoms of too little of that hormone. The symptoms of too much estrogen mimic the symptoms of too little. Too much testosterone in a guy eventually looks like too little testosterone. It's very important to differentiate what's causing the symptoms. Does he have too little testosterone or too much?